2015 open enrollment for healthcare and flexible spending accounts starts May 1 and ends May 22, 2015. We'll take a look at plan options and your choices during open enrollment, changes to your benefits for July 1, earning a premium reward for the new plan year, and flexible spending accounts. Only you know your family's health care needs, so think carefully before you decide to make changes during open enrollment. Here are your options. You can enroll or change your health plan. Of course, you can always keep your current plan. You may also want to consider optional buy-ups for CovaCare, Cova HDHP, and Cova Health Aware. These can be purchased for an additional premium. You also have the choice to waive coverage in state health benefits. Open enrollment is the time to think about adding or removing family members from your coverage. It's important to remember that if you add a family member, you will need to submit proper documentation to your benefits office. And also keep in mind that if you enroll or fail to remove an ineligible family member, you can face disciplinary action or be removed from the health benefits program for up to 3 years. In addition to health care, you can enroll in a flexible spending account, or FSA, during open enrollment. There are 2 accounts, health and dependent care. You can enroll in one or in both accounts. Remember that you must enroll every year to have an FSA. Here are the health plans available to you this year. Cova Health Aware is offered statewide, and Aetna administers all benefits. CovaCare and Cova HDHP are also statewide plans administered by Anthem Blue Cross and Blue Shield and Delta Dental of Virginia. The Kaiser Permanente HMO is a regional plan offered primarily in Northern Virginia. The statewide TRICARE supplement coordinates with the federal TRICARE plan and is administered by Selman Company, ASI. Let's take a look at the CovaCare and Cova HDHP statewide plans administered by Anthem. For CovaCare and Cova HDHP, Anthem administers medical benefits, behavioral health, and the Employee Assistance Program, or EAP. There are also prescription drug benefits, and Delta Dental partners with Anthem for diagnostic and preventive dental benefits. Anthem has a wide-ranging Blue Card network for coverage in the U.S. and abroad at the in-network level. For both plans, in-network preventive care is covered at 100% with no copay or coinsurance. For CovaCare, you pay copayments for most services. There are some services with coinsurance after you pay a deductible. For Cova HDHP, you meet a deductible and then pay coinsurance. And you may also set up a health savings account, or HSA, on your own to help you pay for out-of-pocket expenses with tax-deductible funds. While you can purchase out-of-network coverage for CovaCare, there is no out-of-network coverage for Cova HDHP. Let's talk about several CovaCare changes coming July 1. The plan year deductible will change to $300 for one person and $600 for 2 or more persons. Prescription drug copayments will count toward the out-of-pocket expense limit, and the copay for physical therapy will decrease to $15 per visit. Under the vision and hearing optional benefit, the routine hearing exam will be covered once per plan year instead of once every 48 months. There are no plan changes to the Cova HDHP. There are 3 optional benefits available with CovaCare: expanded dental, routine vision and hearing, and the out-of-network option. Cova HDHP offers expanded dental. Delta Dental administers dental benefits for CovaCare and Cova HDHP. These plans automatically include basic dental services with 100% coverage for diagnostic and preventive services such as routine exams and cleanings, as well as sealants and fluoride for children. These services are not subject to the deductible and annual maximum. Remember that if you and your family need anything other than routine dental work, You will need to purchase the expanded dental option during open enrollment. Expanded benefits include a $50 individual deductible, 80% coverage for such things as fillings and root canals, 50% coverage for services such as crowns and bridges, and 50% coverage for orthodontics. If you have questions, call Delta Dental Customer Service. If you have expanded dental coverage, you may also purchase an optional buy-up for CovaCare to cover vision and hearing benefits. Remember that vision services related to medical conditions are covered in the basic plan. Covered vision services through the Blueview Vision Network include your annual routine eye exam, eyeglasses, contact lenses, and discounts on eyewear accessories. The hearing portion of the buy-up includes a routine hearing exam, which will be covered once per plan year. Hearing aids and other hearing aid-related services are covered every 48 months up to a $1,200 limit. The out-of-network option pays for covered services received outside the network at the in-network level, less a 25% reduction in the amount paid by your plan. The provider may balance bill for any amounts that the plan doesn't pay. You may want to consider this option only if you want to see a provider who is not in the Anthem PPO or the Blue Card PPO network for care in the U.S. The CovaCare and Cova HDHP plans include an important benefit for your well-being, the Employee Assistance Program, or EAP. Each plan year, the EAP provides up to 4 visits of free counseling per issue for members and those living in their household. It addresses mental health and workplace issues, parenting and child care, and other topics that apply to work and life balance. There is a dedicated website for state members at www.anthemeap.com. With Live Health Online, there's always a doctor in the house. Starting July 1, you can consult with a doctor anytime, day or night, from your smartphone, tablet, or computer with a webcam. Just download the Live Health Online app or sign up at livehealthonline.com. Choose from a broad network of U.S. board-certified doctors who average 15 years of experience practicing medicine and are specially trained for online visits. The cost for a visit is $25 under the CovaCare plan, the same as a PCP visit. It's $49 under Cova HDHP before meeting the plan year deductible, then 20% coinsurance once the deductible is met. Now let's take a look at the Cova Health Aware statewide plan administered by Aetna. Cova Health Aware is a comprehensive consumer-driven health plan. The Cova Health Aware Basic Plan includes coverage for all of the major health benefits provided by the Commonwealth, as well as a few extras such as annual routine vision and hearing exams at no additional cost to you. Cova Health Aware also includes a health reimbursement arrangement, or HRA, to help you pay certain out-of-pocket costs. Members can use health reimbursement arrangement, or HRA, funds to pay for out-of-pocket medical, behavioral health, and pharmacy costs. The best part is that this all happens automatically when the claim is processed. And it's important to note that expenses paid by the HRA count toward the annual deductible and out-of-pocket maximum. If funds remain in the HRA at the end of the plan year, they roll over into the following plan year as long as the member stays in the plan. And Aetna helps you keep track of the HRA with online tools that can be accessed 24/7. You can find more information on these tools by calling the Aetna Concierge line at 855-414-1901 or by visiting www.covahealthaware.com. At the beginning of the plan year, an individual employee or retiree will have a new $600 contribution in their HRA. If they cover a spouse, the amount will be $1,200 for the participant and their spouse. This will be in addition to any funds rolled over from the previous year. Remember that you can use funds from the HRA to help pay out-of-pocket expenses for all covered family members. It's also important to note that the HRA is prorated for employees or retirees who enroll in COVA Health Aware after July 1 and members who have certain qualifying mid-year events during the plan year. More information about that can be found at www.covahealthaware.com. COVA Health Aware uses Aetna's comprehensive nationwide provider network. In-network preventive care is covered at 100%. For other in-network services, you first meet an annual deductible. Then the plan pays 80% and you pay 20%. The plan continues to pay 80% until you reach your out-of-pocket max, at which point the plan pays 100% of expenses for the rest of the plan year. Out-of-network coverage is provided as part of the standard plan, but your out-of-pocket costs are more. You have to satisfy a higher deductible, and then the plan pays 60% and you pay 40%. Eligible members can get extra contributions to their HRA by doing things to improve their health, like getting an annual physical or tracking workouts online. These are called do-rights. Let's talk about the do-rights. An employee, retiree, and/or their enrolled spouses can earn an additional $50 per do-right for their HRA, up to a total of $150. If the employee or retiree and their enrolled spouse both participate, together they can earn up to $300. Under the COVA Health Aware plan, it pays to be healthy. You can see here a list of the do-rights you can complete to earn extra HRA contributions. The COVA Health Aware plan has two optional benefits. You can purchase expanded dental at an extra cost, and also a combination of expanded dental and expanded vision. If you need additional dental coverage beyond what is provided in the COVA Health Aware Basic Plan, you can purchase the expanded dental option. This option includes an individual deductible of $50. Once the deductible is met, the plan covers primary services like fillings, extractions, and root canals at 80%, and complex restorative services like crowns and dentures at 50%. There is a $2,000 plan year maximum. Expanded dental also includes coverage for orthodontia at 50% with a lifetime maximum of $2,000. While you receive an annual eye exam under the basic COVA Health Aware plan, you can also purchase expanded vision. This includes an annual allowance toward the purchase of eyeglasses, contact lenses, and also access to discounts on other vision services. COVA Health Aware also includes the Employee Assistance Program, or EAP. The Resources for Living EAP provides up to 4 visits of free counseling per issue each year for members and those living in their household. Counselors can assist with mental health and workplace issues, parenting and child care, and other topics that apply to work and life balance. The direct website is www.mylifevalues.com. More information is available at www.covahealthaware.com or by calling 888-238-6232. Starting July 1, you and your enrolled family members have 24/7, 365 access to U.S. board-certified doctors and pediatricians who can diagnose and recommend treatment by phone or online video and prescribe medications, all for less than a traditional doctor's visit. You pay $40 per consultation, which applies to your deductible and can be paid from your HRA. When the deductible has been met, you pay 20% coinsurance. Visit www.teladoc.com/Aetna or call 1-855-TELEDOC to learn more, set up an account, or request a consultation. The 3 plans we've just talked about, COVA Care, COVA Health Aware, and COVA HDHP, have something in common for you as a member. It's the My Active Health program for helping you improve your health. My Active Health provides coaching services for COVA Care, COVA Health Aware, and COVA HDHP, and partners with Anthem and Aetna to deliver services that promote healthy lifestyles and help you manage chronic conditions. My Active Health includes a web portal that is customized for each participant, spouse, and dependents. All eligible adult members may access the portal, complete their individual health assessment, and obtain a physician results form to complete their biometric screening. Plus, you receive enhanced online coaching and web tools for tracking your health, like interactive trackers and games. My Active Health includes programs at no cost. Healthy Lifestyles provides lifestyle coaching on smoking cessation, weight management, stress management, nutrition, and exercise. Healthy Beginnings helps expectant moms be healthier so they will deliver healthier babies. And the Healthy Insights program helps you manage chronic conditions like heart disease or diabetes. The Healthy Insights program also has some special incentives for members of COVA Care or COVA Health Aware. When requirements are met, it provides for certain free diabetes drugs and supplies and certain free prescription drugs for hypertension, COPD, and asthma. For Healthy Beginnings, expectant moms can qualify for a copay waiver or an HRA contribution. Now let's move on to the Commonwealth's regional plan, the Kaiser Permanente HMO. The Kaiser plan is offered primarily in Northern Virginia and the Fredericksburg area, and also in other state zip codes. You can enroll in Kaiser if you live or work within the service area. The Kaiser Permanente HMO has no deductible for in-network services, but you must use Kaiser HMO participating providers except in an emergency and choose a PCP for each enrolled family member. There is no out-of-network benefit. If you have questions about eligibility for the Kaiser plan and specific plan benefits, contact Kaiser directly. The final plan we will highlight is the TRICARE supplement administered by Selman Company, ASI. The TRICARE supplement coordinates with federal TRICARE benefits. You and your dependents may participate in the TRICARE supplement if you are eligible for the State Health Benefits Program and TRICARE as a military retiree or the spouse of a military retiree. One note, you cannot be eligible for Medicare. If you enroll, you are responsible for paying 100% of the monthly premium, and active employees pay with pre-tax dollars through payroll deduction. If you enroll in COVA Care or COVA Health Aware, you can earn a premium reward to reduce your premium every month and help you get on the road to better health. Employees, retirees, or their spouses enrolled in COVA Care or COVA Health Aware as of July 1, 2015 are eligible for a premium reward. As an employee, retiree, or spouse, you can save $17 a month. And together, participants and spouses can save $34 a month. To earn a premium reward beginning July 1, 2015, you must be enrolled in COVA Care or COVA Health Aware. By June 30, 2015, you need to complete or update your health assessment at www.myactivehealth.com/COVA. A health assessment completed as early as March 1, 2015 will qualify. You also need to report your biometric screening results. If you have already submitted your results, there's no need to report them again. Measurements taken as far back as April 1, 2013 will qualify. If you need to report results, download a physician form from My Active Health and submit them by June 30th. If you are not sure you have submitted your results, contact your benefits administrator. A spouse who is not enrolled in a state health plan will need to call the toll-free number to complete the healthy actions. Regardless of your current plan enrollment, you can complete the requirements for a premium reward by June 30th, 2015, even if you are not enrolled in COVA Care or COVA Health Aware. One important note on premium rewards. If you are eligible and did not meet the requirements by June 30th, once you complete and submit both a health assessment and a biometric screening, your premium rewards will begin the first day of the following month. The Flexible Spending Account, or FSA, is available to state employees eligible for the State Health Benefits Program. It is not available to retirees. The FSA is a great way to save money before taxes. It allows you to set aside funds from your paycheck pre-tax to cover eligible expenses. On average, an FSA saves you about $30 on every $100 spent on things you may already be paying for out of your pocket, like copays, deductibles, and coinsurance. It's important to plan FSA spending carefully because you can't carry over funds from year to year. This plan year, the Health FSA will let you set aside up to $2,550 in pre-tax dollars to pay for eligible health expenses. That's $50 more than the amount you could set aside last year. With the Health FSA, you'll receive a convenient benefit card that you can use instead of paying out of your pocket at the point of service. The Dependent Care FSA lets you set aside up to $5,000 in pre-tax dollars per year to pay for dependent care expenses. You need to enroll each year to have an FSA. And remember that you may lose funds at the end of your coverage period if you haven't filed for reimbursement by the plan's deadline. Members in COVA Health Aware should calculate their FSA contributions carefully, since the HRA will pay first for certain expenses. Employees who are not enrolled in an FSA can go to www.anthem.com/COVA to learn more. You can use the online calculators to help estimate how much money to put aside in your account. Download the 2015 FSA Sourcebook and take a look at the FAQs for both the health and dependent care accounts. Starting July 1, new participants can register on the FSA site and start an online account to view account balances, account activity, direct deposit, and online payments. And guess who's back this year to give you online benefits counseling? It's Alex himself. He can walk you through the health plan options and will use your input to let you know how the plans work for you. Alex has a new look and additional modules this year, plus some new jokes. So check out Alex at www.alexforcova.com. Remember, the final decision on a plan is yours to make. Here's where you can get details on open enrollment. For more information, you can go to Spotlight or the Retiree Open Enrollment booklet, get information from your agency benefits administrator, or you can contact the plans or visit www.dhrm.virginia.gov. We've talked about the plans, your choices during open enrollment, and the changes this year. So think carefully about your options and what's best for you and your family. Once you've decided, make your election. Log on to Employee Direct and select Health Benefits Enrollment and Information, or you may submit an enrollment form to your agency benefits administrator. Remember, open enrollment ends May 22nd. Be sure to make your elections as soon as you can, and don't wait until the last minute.